everyone. Happy evening. I believe all of you are doing well. And welcome to today's YouTube live session where we are going to discuss biochemistry mnemonics. Extremely important topics, rapid revision with quick, easy tricks that will help you remember many points in biochemistry. So, can you let me know whether the audio visual is all good, guys? Alright, that's great. And I hope all of you have attended the part 1 mnemonics. You are thinking that this is part 2. Where is part 1? Part 1 we had discussed today on the app. It was a free live class. If you have missed that, then you can watch the recorded session as well. Alright. So part 1 is basically on the app and you can watch it as a recorded session. If asked for a code while watching to unlock that session, you can use the code Dr. Nikita to unlock that session. And it seems like, yes, and it seems like we might not be able to complete biochemistry even with this session, the part 2. So we are planning to have part 3 of biochemistry tomorrow, again on the app, a free live class. So I'll keep you posted on Telegram group. And tomorrow YouTube class at 10:30 p.m. what we have is embryology mnemonics. So we'll try and consolidate and rapidly review embryology, the germ layer derivatives, your pharyngeal apparatus, aortic arch derivatives, paramesonephric, mesonephric duct derivatives. All of that we'll try to simplify, okay, tomorrow 10:30 p.m. So biochemistry and embryology tomorrow. Plus subscribers, plus subscription is something which gives you access to both live and recorded. And the best part, it has very structured courses. And we are soon coming up with printed notes. You have only 1 week left. If you subscribe, then you get the printed notes as well. With 12-month and above subscription, you get the printed notes. Alright. An iconic subscription is Prep Ladder and Unacademy together. So students who have 1 year, 2 year, 3 year timeline before appearing for PG entrance, this is the best, the most cost effective thing that you can have, both Unacademy and Prep Ladder together. Special class, as I mentioned, is the free live classes on the platform. There are multiple going on. You need to download the app, and while unlocking the classes, it might ask you for a code. The code is Dr. Nikita. Alright. And the grand test, I hope, treated you all well, except for some glitches. We'll try and improve on that. And the FMG students, I hope, have started preparing. And also the NEET 2021 students, emergency MCQs, last 3 year PYQs, do not forget on that. Okay, do not forget on that. So let's start with the today's class, directly jumping to the enzymes and amino acid disorders, because the first 26 pages I have already shared the PDF on the Telegram group, so everyone can get the PDF and make notes as we discuss, okay, for this session. Till 26 page of this PDF we have discussed on the app, okay, in the today's class. Now continuing it further, the rest of it, let's start with page number 27. So enzymes in various amino acid disorders, very important topic, that is amino acid disorders. All right, okay. Where to watch last 3 year PYQs, Dr. Happiness? It is available as a plus, ongoing plus course. If you are there on the plus platform, you can definitely check out that batch. So Tariq Siddiqui, glycogen storage disorders, lysosomal storage disorders, I discussed in the today's 5 p.m. class. You can go back and watch that. And mucopolysaccharidosis I've discussed in one detailed session in the plus on glycosaminoglycans and mucopolysaccharidosis. All the tricks how to remember I have shared there. Okay. All right. So let's start with this one, disorder and the enzyme deficient. Phenylketonuria. What is the enzyme deficient? What is the enzyme deficient? Phenylketonuria is phenylalanine hydroxylase. Okay, that is phenylalanine hydroxylase, which basically converts phenylalanine to What does it convert phenylalanine to? It converts phenylalanine to tyrosine. Okay, it converts phenylalanine to tyrosine. So in that case, guys, if it's not visible, I'll zoom it a bit so that it's visible to everyone. Okay. So in that case, what happens is tyrosine, if I ask you, is it an essential amino acid or is it a non-essential amino acid? It is a non-essential amino acid routinely because it is synthesized from phenylalanine. But since in phenylketonuria, this is not working, tyrosine becomes an essential amino acid. Okay. So remember that tyrosine becomes an essential amino acid in phenylketonuria. What is the order of urine that we have read? What is the order of urine in phenylketonuria? F for M. If you've watched the yesterday's video, F for M and M for F. Phenylketonuria, it has mousy odor. Other symptoms that you will have in the patient of phenylketonuria, because tyrosine is affected, तो आगे आपका melanin वगैरह affect होगा, pigment के problems होंगे, there would be intellectual problems, okay, there would be delayed development. Phenylalanine tyrosine, it is required for your brain, okay. Phenylketones are accumulated, that is why this is phenylketonuria. Next, tyrosinosis, that is tyrosinemia type 1. Which is basically your hepatorenal syndrome, which causes liver failure, hepatocellular carcinoma, renal failure. In that, the enzyme deficient is fumarate acetoacetate hydrolase. So remember, first is F, tyrosinemia type 1, that is first one. The enzyme is F, fumarate acetoacetate hydrolase. I'll tell you the rest of them as well. Maple syrup urine disease is basically a problem with the maple syrup urine disease is with branch chain amino acids. So you have the enzyme deficient, which is branch chain alpha ketoacid dehydrogenase. Okay, it is branch chain. So guys, if there's a problem with the live streaming, like every day it happens, we need to go back to the link and join back. Yes. So that is your branch chain alpha ketoacid dehydrogenase. Now some important points that I remember here, which are the other enzymes which have the same coenzymes, the same vitamins. आपके 3 enzymes होते हैं जिनके same coenzymes होते हैं vitamins B1, B2, B3 और आपका which one is that? Which are the 3 enzymes? 3 enzymes which have the same coenzymes. One is your branch chain ketoacid dehydrogenase. Second one is alpha ketoglutarate dehydrogenase. And which is the third one? Pyruvate dehydrogenase. Okay, remember they have the same coenzymes. If asked a question, what vitamin supplementation will help in maple syrup urine disease? Then remember it is vitamin B1. Thiamine supplementation helps. It is one of the coenzymes which is there. Now maple syrup is, the smell is maple syrup or burnt sugar or caramel. That is what the history would be. Alkaptonuria is basically a problem with which amino acid metabolism? Alkaptonuria is a problem with tyrosine metabolism. Okay, it is tyrosine metabolism. And what is the enzyme deficient? It is homogentisate oxidase. Okay, it is homogentisate oxidase. What do we use in treatment? What is used in treatment? Alkaptonuria, tyrosine metabolism mein what is used in treatment? Absolutely right. So remember, nitisinone is used in treatment. Okay, it prevents your homogentisate formation. And alkaptonuria, classically the clinical history would be urine turning black on standing, and there is ochronosis, cartilage pigmentation ho jata hai. There is ochronosis and black urine. That is the history. Albinism again is tyrosine metabolism. The enzyme deficient is tyrosinase. Tell me, what is the cofactor for tyrosinase? What is the cofactor for tyrosinase? Is it magnesium, manganese, copper, zinc, molybdenum? What is the cofactor? Absolutely right. It is copper. We will see the mnemonics. For Y containing enzymes, it is copper. Okay, that is the mnemonic that we have seen. Homocysteinuria type 1. This we discussed in the today's 5 p.m. class. It's a classical type of homocysteinuria. Classical is your B6 deficiency, vitamin B6 deficiency. 6-thionyine, वो mnemonic हमने देखा. 6 is 6-thionyine synthase deficiency. Homocysteinuria, the rest of them basically is a problem in methylcobalamin formation, right? We saw the pathway कि methionine forms homocysteine and then homocysteine forms cysteine, right? If you have a problem here, it is classical one, B6 deficiency. If we have a problem here, homocysteine to methionine, methionine वाला methylcobalamin, यहाँ पे ये B12 और folate वाला problem है, okay? So homocysteinuria can be due to B6, B9, B12, the multiple of 3 vitamins का deficiency, okay? Of course, Eva, this is all the must know topics that you need to revise before the exam. That is why I'm discussing here, okay? This is like must know. This is not all inclusive, but this is like the must know that you should do. So if it is out of 100 which is must know, I am covering like 60 to 70. There is still more that you need to revise. Cystathionine is cystathionase. Tyrosinemia type 2. Okay, type 2 is T. The enzyme deficient is TAT, tyrosine amino transferase or tyrosine transaminase. So remember, type 2 is TAT, type 1 F is F, fumarate acetoacetate hydrolase in your type 1, right? Primary hyperoxaluria, very, very important. If they give you a clinical scenario where the patient has calcium oxalate, there is oxalate stones, renal stones, what is the metabolism defect? Which amino acid is defective? Remember, this is basically your glycine metabolism which is defective. You can remember it as glyoxylate. It is forming from glycine. So that is your glyoxylate wala. It's a glycine metabolism. So alanine glyoxylate amino transferase is the problem here. That will cause primary hyperoxaluria. Okay, that will cause primary hyperoxaluria. Then tyrosinemia types. Tyrosinemia type 1 हमने already देखा. It is hepatorenal. Hereditary tyrosinemia, also called tyrosinosis. F for F, it is fumarate acetoacetate hydrolase. Tyrosinemia type 2 is something which is called as Richner-Hanart syndrome. Okay, that is your Richner-Hanart syndrome. And it has TAT deficiency. This is your oculocutaneous. Remember type 2, आपके 2 words, Richner-Hanart, oculocutaneous. Tyrosinemia type 3, which is neonatal tyrosinemia. 3 के बाद आता है 4. Remember, it is 4 HPPD. Okay, it is 4 HPPD. Now, when you have the gene for 4 HPPD, where you have mutation, missense mutation, then it leads to Hawkins urea. Remember HPPD gene ka missense mutation. I think there's some problem with this, not able to write well. So you have H for H, it causes Hawkins urea. I hope all of you remember the urine odor in Hawkins urea is hawk, the bird in the swimming pool. That is your swimming pool odor. Okay, that is the swimming pool odor. That is what we see. So remember tyrosinemia type 1, FAAH, it is hepatorenal, it is hereditary, it is tyrosinosis, Richner-Hanart, oculocutaneous. Type 2 is TAT, 3 is 4 HPPD, and Hawkins urea is again HPPD ka gene wala mutation. Okay, gene wala mutation, right. Going to the next topic, that is amino acid special group. If they give you that, kaun se amino acid mein kaun sa group hai? So this is the table that we need to revise. I have had a recent video on my YouTube channel where I have discussed the various tests for amino acids based on the groups that they have. So please watch that as well. I am not including the test here. Okay. So arginine, guanidinium group किस में होता है? Guanidinium group. So remember GU. इसका टेस्ट किसी को याद है? Guanidinium group के लिए हम कौन सा टेस्ट करते हैं अमाइनो एसिड वाला? What test is done? So remember, GU is your GU, that is your, absolutely right, that is your Sakaguchi test. Okay, guanidinium group ke liye it is your Sakaguchi test, and the amino acid is also G wala, that is arginine. Okay, arginine, G is guanidinium group. Okay, that is guanidinium. Then you have phenylalanine which has benzene group. Benzene यानी aromatic basic वाला जो सबसे basic aromatic amino acid, that is phenylalanine. So remember, it contains benzene. Tyrosine contains phenol group. So tyrosine का mnemonic जो हमने already देखा है, cab का टायर जिसमें से fumes निकल रहे हैं, cabbage odor, tyrosinemia, it forms fumarate. Also remember phenol, F for phenol. So tyrosine forms, it contains phenol group. Imidazole group is present in histidine. So remember high, H के बाद आपका I आता है. Remember it as high, that means histidine contains imidazole group. Then you have pyrrolidine group is present in pyrrolidine, PRO, that is present in proline. Thioether linkage, thiomethionine, THIO, it is present in methionine, thioether linkage, not the thiol group. Okay. And then you have your indole group is present in tryptophan. Indole is India ka flag, that is tricolor. Okay, India ka flag tricolor. Indole group is present in tryptophan. We have seen tryptophan forms B3, serotonin, melatonin. You know, today we discussed another point. Your xanth urinic acid, urea जो रहेगा tryptophan metabolism में रहता है. कौन सा विटामिन डेफिशिएंसी में होता है? Which vitamin deficiency causes xanth urinic acid urea? Amisha, first part is there on the Unacademy app under my profile. You'll get that, or I've shared the link on the Telegram group also, so you can get the direct link from there as well. नहीं, niacin नहीं है. Okay, niacin नहीं है. Your xanth urinic acid urea is seen in B6 deficiency. आज शाम में discuss किया in the class. It is in B6 deficiency, pyridoxine deficiency, not niacin deficiency. Okay. So that is about the special groups. Everyone clear? A quick revision. What did we see here is guanidinium, arginine, benzene, phenylalanine, phenol, tyrosine, imidazole, histidine, pyrrolidine, proline, thioether methionine, and indole is tryptophan. Okay. Give me a quick thumbs up if everyone is here on the same page with me. Everyone is clear with the mnemonic so far? So we've seen the enzyme deficiencies, we've seen the special groups in the amino acids. Okay, so that is what we have seen so far. Going to the next one, that is again on amino acids, which is most acidic and which is most basic. Okay. As the term says, acidic, so aspartic acid, glutamic acid, of course the name itself tells this is acidic amino acid. If the question is which is most acidic, okay, which one is most acidic? So aspartic acid, remember AA wala, the most acidic, most basic is AA wala. Aspartic acid is most acidic. Arginine is most basic. Okay, AA वाले सबसे ऊपर maximum, aspartic acid and arginine. Basic मतलब your amine group, basic वाले amine. So you have INE, lysine, arginine and histidine. Remember hull. Okay, so hull is basic. Okay, hull is basic. Out of that, arginine is most basic. Okay, so most acidic aspartic, most basic arginine. Coming to the next one, which are essential, which are non-essential, which are glucogenic, which are ketogenic and which are both. सबसे पहले essential वाले का mnemonic देखते हैं. The mnemonic for essential is private Tim Hall. Okay, just keep saying this. Private Tim Hall. Okay, private Tim Hall. So phenylalanine, valine, threonine. Tim is your tryptophan, isoleucine, methionine. Histidine, arginine, leucine and lysine. According to some sources, histidine and arginine, they are semi-essential. Not totally essential, they are semi-essential. So you can remember this is A. Okay, you can keep saying like A, I forgot to put this in your semi-essential. These are actually semi-essential. These are semi-essential. So remember, okay, so that comes as a surprise. These are not essential. These are semi-essential. Arginine and histidine. Okay, arginine and histidine. So all your branch chain wale leucine, isoleucine or valine, these are your essential amino acids. Okay, so leucine, isoleucine and valine branch chain wale essential hai. Your phenylalanine, then tryptophan, which is not essential. Aromatic mein it is tyrosine. Okay, tyrosine is not essential because it can be synthesized from phenylalanine. So if you look at the table here, okay, again have a look at this table. Essential wale jo humne dekhe, private Tim Hall, you have P, V, T, and then you have Tim Hall, T, I, M. Then you have H, L, L. A is kept here, arginine is kept here in semi-essential. Okay, arginine is semi-essential. Now, if the question comes like this, which of the following is essential and it is purely ketogenic? Which are purely ketogenic amino acids? Leucine and lysine. So remember, ketogenic, K के बाद आता है L. Okay, ketogenic, K के बाद L. So your L wala amino acids, that is leucine and lysine, are purely ketogenic. Okay, they are purely ketogenic. Out of that, the next one, which are both glucogenic and ketogenic, and they are essential. So you have phenylalanine tryptophan, the aromatic amino acids, and isoleucine. Iso, remember, iso forms. That means iso matlab two forms. So it is two forms. Okay, it is both the ketogenic and the glucogenic. So remember, isoleucine, phenylalanine and tryptophan. Now if the question is which of the following amino acid is non-essential and both the ketogenic and glucogenic, then it is tyrosine, because we know that tyrosine is non-essential, and we also know that what compounds does tyrosine form. If you remember the enzyme deficient FAAH, tyrosinemia type 1, fumarate acetoacetate hydrolase. That means it forms fumarate and it forms acetoacetate. So it forms both fumarate and acetoacetate. That means fumarate enters your TCA cycle, glucogenic. Acetoacetate is a ketone, it is ketogenic. So remember, tyrosine is both, but it is non-essential. Okay, but it is non-essential. All right. और बाकी जो है ये चले जाएंगे आपके ग्लूकोजेनिक में. These are purely glucogenic. So whenever you have list like this, always try to remember the smaller list. Automatically you will remember the, you don't need to remember the longer list. All right. So remember, leucine, lysine are purely ketogenic. K के बाद आता है L. Aromatic amino acids, phenylalanine, tyrosine, tryptophan, they are both. Out of that, only tyrosine is non-essential. The rest of the two are essential. Branch chain amino acid, which is both glucogenic and ketogenic, is isoleucine. Okay, that is isoleucine. Is this clear with everyone? Okay, let's go to the next one. Now coming to your next topic, asked in the recent NICT exam, hormone sensitive lipase versus lipoprotein lipase. If I ask you which of the following is activated by insulin? Insulin activates hormone sensitive, lipoprotein, or both? Does it activate hormone sensitive, lipoprotein, or both? So I see majority of you getting this right. Remember, it is lipoprotein lipase, not hormone sensitive lipase. Easy है इसको याद रखना, nothing very difficult to remember. If you understand the terminology, lipoprotein lipase पढ़ा है हमने when we discuss in the special class lipoproteins, your hyperlipidemias. What is the role of lipoprotein lipase? So it is breaking down a lipoprotein. Which lipoprotein it is breaking down? Your chylomicrons and VLDL. It is hydrolyzing triacylglycerol in your chylomicron and VLDL, and then these chylomicron and VLDL are converted to the remnants. Okay, they are converted to remnants, right? So where are these triacylglycerol hydrolyzed and gone? They get deposited in the adipose. So basically it causes adipose deposition. So is this catabolic or is this anabolic action? This is anabolic action. And anabolic hormone कौन सा है हमारी बॉडी में? It is insulin. Anabolism कब होता है? When we are well fed. Catabolic कब होता है? When we are starving. So everything making sense if you connect the dots. So lipoprotein lipase is basically your anabolic enzyme because it is causing adipose deposition, and that is why it is activated by insulin in the fed state. Where is it present? It's a functional enzyme. Remember, lipoprotein lipase, functional enzyme, plasma में active है. It is present in the capillaries. Opposite is what you will see in hormone sensitive lipase. It hydrolyzes triacylglycerol in adipose tissue. So basically this is causing lipolysis. That means this is catabolic. That means opposite of insulin, glucagon fasting state में ये active है. Where is it present? It is present in the adipose site. So remember at least like lipoprotein lipase, chylomicrons diet में आपके बनने के बाद then they are hydrolyzed, deposited in adipose. So it is anabolic. Hormone sensitive lipase is catabolic, and that is why the enzyme which is anabolic, that is activated by insulin. Okay, that is activated by insulin. All right. Next one, lipoproteins. A quick review on the table. Which one has the maximum density? Which one has the maximum density? Yes, glucagon stimulates hormone sensitive lipase. Right, it's the opposite of insulin. Catabolic state में activate होता है. I am asking about maximum density. So as the term itself says, high density lipoprotein. So it is HDL. The density is decided by the protein वाला content which is maximum in HDL. Okay, chylomicrons की कम रहेगी क्योंकि इसमें triacylglycerol ज़्यादा है. Which one has the maximum triglyceride content? Exogenous and endogenous. Which one has the maximum triglyceride content? Exogenous is from the diet. Intestine में बनता है chylomicron. Endogenous liver से सबसे पहले आने वाला, that is VLDL. So it is chylomicron and VLDL. Exogenous and endogenous. Okay, exogenous and endogenous. Next one, so you can see here maximum triacylglyceride, chylomicrons 98%, VLDL 60%. Which one has maximum cholesterol? Cholesterol matlab bad cholesterol, that is LDL. Okay, maximum is with LDL. Maximum phospholipid. Phospholipid is a good one. Remember, phospholipid is a friendly one. Phospho is friendly. Good wala kaun sa hai? HDL. Okay, that is your HDL. So maximum phospholipid is in HDL. If I ask you that in electrophoresis, which one does not move? Okay, which one does not move on electrophoresis? Very good, Ruby. Absolutely right. So that is chylomicrons. Remember, the mnemonic is chylomicron, C for C. They remain at the cathode. Okay, they remain at the cathode. और सबसे fastest move करने वाले कौन से हैं? Maximum जो जाते हैं सबसे fastest. Very good. That is your HDL. This is your alpha wala lipoprotein. Alpha going to the anode. That means maximum. Anode के पास जाने वाला. That is your HDL. Okay, that is HDL. Which has the largest size? Which has the largest size? सबसे बड़ा size किसका होता है? Yes, that is chylomicron. So remember that chylomicrons, they have the largest size, and that is why they are too lazy to move around. Someone who's very big in size does not move around. So chylomicrons, they sit at cathode, okay, because they have a very, very large size. Okay, that is how you can remember. Apolipoproteins, tell me what is the apoprotein for chylomicron? What is the apoprotein for chylomicron? It is B48. Okay, it's B48. LDL is B100. Chylomicron remnant. Remnant RE, that is your ApoE. Okay, that is ApoE. HDL is like your A type, good type lipid. It is your apoprotein A1. Okay, it's a good cholesterol. That is A1 personality ka, A1 grade ka. So ApoA1. Okay, that is ApoA1. B48 and B100, they come from the same gene. The difference is there is a premature termination. Basically आपका जो RNA editing होता है उसमें problem है RNA splicing में in B48 and B100. Okay, so remember B48, B100, E and A1. Okay, E and A1. That is very, very important to remember. Lipoprotein lipase is activated by which apoprotein? Which apoprotein activates your lipoprotein lipase? Very good. That is your ApoC2. Okay, remember that is your ApoC2. Remember L and L दो बार आता है, ये दो बार वाला ApoC2. So when you have ApoC2 deficiency, which hyperlipidemia, dyslipidemia, which type does it lead to? Type 1, 2, 3, 4, 5. तो लाइपोप्रोटीन लाइपेज एक्टिवेट नहीं होगा, तो इसीलिए आपके काइलोमाइक्रॉन्स नहीं डिग्रेड होंगे. So that is your type 1 where you get increased chylomicrons and to some extent increase VLDL. Chylomicron increases more. So remember that is your type 1. Type 2 is your cholesterol वाला, LDL वाला. Okay, वो LDL वाला है, B100 में जहाँ डिफेक्ट वगैरह होगा. ये है आपका type 1. Guys, if you are still confused about lipoproteins, your hyperlipidemias, lipid lowering drugs, please watch the recent special classes. Those are the free classes that I have taken. All your doubts will be cleared in that topic. Okay, very, very important. Next वाले पे चलते हैं. I think this is the final one, or maybe we can stop here and we can continue the biochemistry mnemonics part 3 में. The next one, which is enzyme cofactors. What say, guys? I think we can continue it tomorrow afresh. I think we have discussed a lot about your amino acids and quickly about your lipoproteins, an overview that we have had. And tomorrow we will continue with your enzyme cofactors, the sites of metabolism, rate limiting enzymes, CPS1, CPS2, enzymes in fed fasting state, branch chain amino acids. बहुत सारे और topics है. We are not even on the half of the PDF yet. Amino acid products. Okay, there are many, many more topics to be discussed. Porphyrias and all. We will discuss that tomorrow. All right. Make sure you keep revising this because everything, each of this is very, very important. Okay. So we will continue this tomorrow in the free live class. I hope all of you join in for that. Tomorrow, I'll let you know the timings on the Telegram group. Okay, it's gonna be on the Unacademy app. YouTube session tomorrow 10:30 a.m. The YouTube session 10:30 p.m. It is on embryology mnemonics. Okay, so 10:30 p.m. on YouTube is embryology mnemonics, and on the app is your biochemistry part 3. Okay, biochemistry part 3 mnemonics. We have done with 2 parts. We'll have the third tomorrow on the app. All right. So thank you so much everyone for joining in. I hope you've liked this session, and do subscribe to this channel so that you stay notified about all the sessions that go on the channel. And also do let me know in the comments if there are any particular topics you want me to revise before the exam, and particularly in biochemistry for the tomorrow's session. Okay, so goodbye, take care, keep studying, keep revising and keep winning. See you tomorrow. Thank you.